Good afternoon, everyone. Thank you for joining us for today's COVID press briefing. My name is Brooke Barnes. I'm with the Scott County Health Department. Today, we will be hearing from Janet Hill, Chief Operating Officer with the Rock Island County Health Department, Edward Rivers, Director, Scott County Health Department, and we also have joining us Tyler Power, Director of Government Affairs with the Quad Cities Chamber. Each of our speakers will have some prepared statements that they will provide for you. We do encourage you to type your questions into the chat. We will go to the questions in the chat after the prepared statements. So please, Janet, start us off with some numbers for Rock Island County as well as any prepared information that you have. Janet, can you unmute yourself before you keep going? Thank you.
All right, can you hear me now?
Yes, I can.
Okay, thank you. We are reporting 4 new cases for a total of 652. Unfortunately, we are reporting our 25th death from COVID-19. The woman was in her 80s and she had been isolating at home. So the total number of deaths in Rock Island County stands at 25. First of all, I want to clarify something that I said during Wednesday's media call. The Rock Island County Health Department is giving only addresses of people who have tested positive for COVID-19 to the Rock Island County Emergency Management Agency. All flagged addresses are purged from EMA's system after 14 days. We are not giving names of COVID-19 positive residents. We take our HIPAA duties seriously and give as little information as possible to protect the safety of our first responders. So that is, my comments from today are as follows. With the unrelenting nature of a global pandemic, you must take your wins when you can get them. Illinoisans are on target for a big win on May 29th. Because we have been listening to public health advice and doing your part to slow the spread of COVID-19, the entire state is on target to achieve the metrics that Governor J.B. Pritzker laid out for moving from phase 2 to phase 3 in his Restore Illinois plans. These are a summary of the changes the governor announced Wednesday. Bars and restaurants can open for outdoor dining with tables 6 feet apart. Health clubs and gyms can provide one-on-one personal training in indoor facilities and outdoor fitness classes for up to 10 people. Personal grooming shops, tattoo shops, and all retail stores can open with safety precautions and capacity limits. All state parks will reopen, including with concessions. Indoor and outdoor tennis facilities can reopen with safety precautions and capacity limits. Golf foursomes will be allowed. Golf carts also will be permitted with 1 person per cart or 1 immediate household per cart. And with the 10-person gathering limit now for all activities, boating or camping with up to 10 people will be permitted. One caveat though, we can't let up because there's still a week to go. A rise in infections throughout our entire region, which is roughly the northwest quarter of the state, can set us back. The governor told us all along that his plan allows for regions to move backward. Please continue to do your part to slow the spread by washing your hands frequently, wearing a facial covering while in public, keeping at least 6 feet between you and others, and staying at home as much as you can and going out for only essential trips. Keep these in mind while accepting your win. Thank you.
Next, we'll hear from Ed Rivers with the Scott County Health Department. Ed?
Good afternoon. Today, the Iowa Department of Public Health website shows 322 positive cases. That's an increase in 10 from yesterday. The site has been updated a couple of times today. I saw a question in the chat about the dates from 5/19 and 5/20 and how they may be different from those on the Iowa Department of Public Health site. As we discussed earlier in the week, they are changing the reporting times on coronavirus.iowa.gov, and you may see differing totals throughout today. It reads now 322, and our number of deaths remain at 8. Regarding Iowa's opening, the state of Iowa and many other states are taking a phased approach to reopening businesses, and other daily activities in our community. Governor Kim Reynolds has indicated that she's using a targeted approach to loosening restrictions based on public health data and trends that are identified. In the past 3 weeks, we've seen various phases of reopening in Scott County and expect to see more in the upcoming days and weeks. As many in the community become anxious to be able to resume more daily activities, we'd like to offer a word of caution to those considering holding events or reopening areas of our community that haven't yet been allowed by proclamation of the governor. We know that league sports and other organized summer activities are beloved elements of summer in Scott County, but choosing to begin these types of activities prior to any announcement by the governor would hold both health and legal risk should an outbreak be connected back to the activity. Please be patient and know that there are more phases of our reopening yet to come. Public health and decision makers at the state level recognize the other areas of our community that many would like to see open up again. Know that these announcements will come in time. You can also expect additional guidance from the Iowa Department of Public Health to help make plans for how to safely resume these types of activities once their reopening is announced. We continue to post guidance for businesses, restaurants, and other entities on our website and encourage community members to visit the site to learn more. Brooke?
Thank you, Ed. We do have Tyler Power, Director of Government Affairs from the Quad Cities Chamber, joining us as well today. So please go ahead, Tyler.
Perfect. Well, thank you for having me, and good afternoon to everyone. Yesterday, Governor Pritzker announced some modifications to phase 3 of his reopening plan in Illinois, and that was welcome news, and it's definitely the step in the right direction in our perspective for our Illinois businesses. And all along, the Chamber has been advocating for the entire Quad Cities region to open up in a safe, responsible, and timely manner, but always in accordance with the CDC and health official guidelines. And as I was mentioned earlier, while we're only 8 days away from successfully meeting those metrics to move to a phase 3, it's still very important to follow the health guidelines and listen to our local health experts so that we can hit that goal on May 29th and continue the momentum that we already have going. The planning and preparation for our businesses are critical tools that they need to help strike a balance between the safety and the economic well-being parts of our region. And barring any resurgence, our messages to the businesses are now is a good time for business to carefully examine their preparations in anticipation of reopening when they're given the go-ahead, hopefully in the near future and in 8 days. So for example, businesses may need to get in touch with product suppliers, definitely implementing new sanitation and social distancing practices, possibly reconfigure their layout, be able to provide PPE for their staff, get their staff trained on the new processes, and also get them on the schedule. So all of those take time to do, and that's why we're encouraging our businesses to start that planning process now. But we still understand that it could happen with a surge that could be pushed back. But the Chamber continues to make readily available resources on our website that provide best practices and some suggested considerations for the businesses to prepare to reopen when the health officials give us the green light. We have our COVID-19 resource guide, as well as our reopening toolkit, which are great resources for businesses in our area to use on both sides of the river throughout the entire region. And we know that in the coming days, the Illinois Department of Public Health is going to be issuing industry-specific guidance, particularly around the workplaces and childcare, so that business owners and the employees of these sectors are ready to go when the economy reopens. And that's all that I have, Brooke. Thank you.
Thank you very much, Tyler, and thank you to Janet and Ed. Next, we are going to go to the chat. Bear with us. We have numerous questions in here, so we'll go through each of these and have everyone have a chance to make comments. So, Ed, the first questions are for you. First, we're going to start. This is about confirmed positive cases. How confident are you in the state of Iowa's confirmed positive cases? And then I'm going to give some context here. It says, we have spoken with a number of people who have had a loved one test positive, and they are told to assume they are positive and to quarantine. Those people are never tested, therefore never counted. So let's start with that first question.
Well, when you speak of confirmed cases, it has a particular definition. That's someone who both has the symptoms and tests positive for a PCR test. They are counted then as a confirmed case. When we do our contact tracing, we have talked to household contacts and those with whom the person has been in contact within 6 feet for over 30 minutes. If those persons are, especially household contacts, are displaying symptoms, they're advised that they may have the disease and that they should isolate for the period of time to make sure they don't transmit it. It is their decision whether to be tested. They can contact their physician or go to and fill out the assessment on the Test Iowa site. And if they test and are positive, they are then counted as a confirmed case. So that's how the system works. There are confirmed cases and there are presumptive cases. And if a presumptive case is tested and is positive, they are then a confirmed case.
Thank you. That covered the second two questions in there. The next question is, can you speak about Test Iowa? There is some concern about the actual tests. Are the health departments confident in the results? We'll start with that, and then there's two additional questions as well.
Well, we've been asked to refer all questions about Test Iowa to the governor's office. They actually have the information that you would need, and we don't have that information.
The second part of that is, will tests increase in Iowa? What direction have Iowa health departments been given related to that?
Sorry, say that again.
Will tests increase in Iowa, and what direction have Iowa health departments been given? I believe this is in relation to Test Iowa.
Yeah, the information that the instruction that we've been given is to refer questions to the governor's office, but you may have seen the governor's press conference today where she noted that through the Test Iowa program, now they plan to make testing available to anyone who desires one. We'll see how that develops.
Thank you. Janet, next question is for you. How many days in a row has there been a COVID-19 related death in Rock Island County?
We've had 5 days in a row of at least one death. We reported one death today, one death on the 20th, 2 on the 19th, 1 on the 18th, and 1 on the 17th.
And also, do you have the hospitalized number for today?
18.
Okay, thank you. Tyler, we do have a question for you. What are you hearing from businesses and organizations that have not been able to reopen yet? Are any of them closing permanently? How are they doing accessing government loans, grants, and other assistance?
Yeah, so I'll take the question in a few different steps. So what are we hearing from businesses that haven't been able to reopen? We're hearing that they're ready to reopen. And we've made sure that through our surveys that they're looking at new protocols to ensure that they're following the CDC guidelines, following the reopening plans in each of their respective states. But they're ready to get back to business, especially for bars and restaurants, retail, really almost any sector that's been impacted. It's been a very severe drop off for them. So we're hearing consistently across the board that they're ready to go. They feel ready to reopen. They're ready to get back to business, but they're also doing it, with a very safe and secure way of doing it. Are any of them closing permanently? I have not had any personal conversations with any of them that are closing. We are still very early in the impacts of what this could mean economically. We're still very much in the recovery phase. So, we hope that none of the businesses are going to have to close, but we also are realistic that there could be some closures in our region. But we're going to do everything that we can to make sure that they stay open, they stay viable. They have all the different tools accessible to them so that they can stay open. And that just leads into the government grants access. We've been connecting businesses all across the region in both states numerous times to all the different resources that are available to them so that they can be sure to access them, keep their employees working, and help mitigate some of the economic hardships that COVID-19 has caused.
Thank you very much for that, Tyler. We do have another question for Ed. I should have asked Dr. Katz yesterday, but what are you seeing in the statistics that leads you to think Scott County has peaked and Rock Island County is close to peaking? I apologize, that's for Janet as well. We are in the process of putting the state's website up, Ed, for some of the graphs that they have for the data they're collecting. Do you have anything additional to add to that?
Well, when one considers being past a peak, you would expect to see declining case numbers over a period of time. And if you paid attention to the numbers being posted for Scott County, they are down from, say, early and mid-April.
Janet, do you have anything to add for Rock Island County?
I would say that we have been reporting lower case numbers also. At the beginning of this, we were regularly reporting 20 plus cases a day, and there are many days now that we report fewer than 10. A slight modification would be on Mondays, because there is a weekend lag sometimes, so Monday's case counts sometimes have been a little bit bigger than the rest of the week.
We did go ahead and link to the state's website, coronavirus.iowa.gov, that has additional information on case counts as well as the graph that Ed and both Dr. Katz have been referring to. So that would give you information on the fluctuation of the numbers that had the additional questions there. If there's any additional questions for Ed, for Janet, or for Tyler, please type them into the chat. Okay, so we're glad to see that everyone is checking those numbers, so we appreciate that. Thank you all for joining us. Thank you to our media partners for being on and helping us share this message with the community. We do anticipate having our next call with all of you next Tuesday at 3:30. So that will be a change in the date. So we do anticipate next Tuesday as well as next Thursday. So we will be sending additional information out on that. Additional numbers for Scott County for the weekend can be found on that coronavirus website, and I believe Janet will still be sending information for Rock Island County as information comes for them daily. So thank you all for joining us, and have a nice weekend.